Hello, fellow classmates. This is Joy Lewis. I'm going to be talking to you today about what works and what doesn't work for retaining staff in the workplace. So we've probably all experienced a work environment with a cohesive group of coworkers, as well as probably an environment where tension and conflict seem to be the more prevailing characteristics. Those coworkers and management relationships really play a huge role in the retention of staff. I know many things in healthcare right now seem to be driven by money and the bottom line, but staff retention really appears to have a different motivator, a different source of motivation. In a review study that was performed by Twigg and McCullough in 2014, found that the most crucial reported work condition affecting retention was a supportive and friendly staff, supportive and effective management, good physical environment and equipment, as well as job satisfaction. So today we're just going to kind of examine this topic a little more in depth, look at some tools to improve retention and some specific obstacles that we might face on our units with staffing in this day and age. So in our textbook, Sullivan notes some of the job satisfiers. I've also listed here a few of the dissatisfiers, which you'll probably notice are the exact same in each column. This is just to kind of show you that all of these factors can be used as a benefit if handled correctly. The relationships with coworkers can seem like something uncontrollable from a manager's role, but conflicts that arise can be resolved with the help of a manager oftentimes. There may be one person in particular that seems to have problems with everyone, and this is definitely something that needs to be addressed by the manager. Shift hours can be painful, and depending on which ones you work or what your non-work life looks like, for night shift people, there's going to need to be another area on this list that can compensate for those staff members. So oftentimes it's a shift differential or something like that, which kind of also leads into the benefits and compensations. Personal expectations are also very impactful on the job satisfaction, so it's important to have this conversation during the interview process of a new hire to ensure that everyone is on the same page. Fair treatment. Often managers originate as a staff member within the organization, and then once that change in position occurs, there can be a tendency to show favoritism to those they get along with as a staff nurse role, and that's certainly something that's not going to gain a lot of respect. And then finally, nursing values in the work setting. A nurse's personal values definitely need to be in alignment and agreement with the workplace that they are employed by to create that job satisfaction as well. So I have a direct quote here from our textbook with a definition of engagement. It's being inspired by the organization, willing to invest effort, likely to recommend the organization, and planning to remain in the organization. So control over practice, the nurse-physician relationships, and professional growth and development are essential aspects to engagement. For this to occur, staff needs to have input in the decision-making process. They need opportunities to develop skills and knowledge. And when problems arise, staff really need to see a prompt response from management, along with good communication to the staff about what's being done. So Twigg and McCullough noted some specific interventions to address these areas. For example, they noted that Magnet Champions can definitely get staff engaged in the workplace. They also have explaining the rationale behind some of the decisions that are made that directly impact the staff. The clinical ladder programs also help with this, promoting special certifications, encouraging autonomy, having a process in place for conflict resolution that does arise between a nurse and a doctor, These are just some of the few things to incorporate. So here I've listed some of the factors that can really improve the work environment. Skilled communication, Sullivan notes that this is just as important as clinical skills. We also have collaboration. This is in reference to all coworkers, nurses, as well as patient care assistants, physicians, social workers, physical therapists. Nurses need to feel that they are part of the decision-making process in the organization. Staffing, which is always a hot topic for conversation. Twigg and McCullough note that staffing really needs to have adequate numbers, but also adequate skill levels. And retaining experienced nurses really needs to be on the forefront of retention efforts. And finally, we have leadership that encourages and engages others in the workplace. Managers need to be visible and accessible to their employees. Twigg and McCullough also add that stability is important with leadership in an organization, and future leaders, the ones that are emerging from the staff, need to be mentored and prepared for this role. So I mentioned before that salaries were not one of the top factors for retaining staff, and it's not, but it is still an area that needs to be addressed. Salary compression is something that Sullivan brings up in the textbook, which is seen by newer nurses starting at a higher pay rate or a sign-on bonus being added in there. These are both great things, but as I said before, we need to consider our experienced nurses also, and if the new inexperienced nurses are getting all of the perks, then the experienced ones will be less likely to stay where they're currently working. Recognition is another important aspect and not something that takes a lot of money or time necessarily, but it does require immediate feedback after a job well done, personalized in a way that makes the individual truly feel appreciated. A personal note kind of goes along with that. The whole idea is to be non-generic. Public acknowledgement can go a long way as well. Encouraging peers to acknowledge each other is also great for camaraderie. And an employee of the month might be beneficial, providing flexible work hours when able to, and also a newsletter could also be a method of recognition. So here are a few additional retention tools that Sullivan mentions. Providing realistic job previews at the time of hire kind of also goes along with the personal expectations and nursing values that I mentioned with the job satisfaction. Movement within the organization can be something that the manager helps with, and adapting to the turnover rate. This can be done by managing rumors about why the other staff members had left, and also keeping a list of former employees who might be interested in filling in on the unit when this does occur. So one interesting article published by the Professional Nursing Today, written by Makoka Key, discusses the obstacles that can arise when working with a multi-generational workforce like we have. We have the traditionalists, or the silent generation, that was born between 1922 and 1942. And they follow instruction well. They don't complain often. Now this generation is probably not on your unit staffed. However, they are certainly the patients that we work with. Then there's the baby boomer generation, consisting of those born from 1948 through 1964. This generation is frequently working past their retirement age and noted for their strong work ethic. And then there's the Generation X, for those born between 1961 and 1981. They're frequently confronting management when something seems off with the decisions that are made. They're also characterized as multitaskers. Generation Y consists of those born between 1980 and 2000, and they're described as optimistic, committed to their jobs, where growth is happening. So despite what I just described here with each generation, there are many who do not fit the stereotype. So with that in mind, here are some other communication tools to keep in mind as well. So the traditionalists prefer that they are communicated with in a personalized manner. So if they're being acknowledged, the personalized tools that we talked about earlier, um, they want to feel that acknowledgement without necessarily being publicly acknowledged. The baby boomer generation, as well as the traditionalists, prefer the face-to-face discussions. They may not be as up to date with texting or email. Generation X and Y prefer the text and email, and they also prefer short and frequent updates. In the work environment, all of these generations can cause a lot of conflict. This very thing has also been linked to staff retention. So it's important to see that each generation has strengths, establish mentorships across generations to grow these relationships and strengthen the unit. There are things from each generation that can be learned by the others. So this is just to kind of summarize what we've talked about already, but a manager needs to be visible and accessible to staff, and encouragement to staff, and a leader in the clinical setting, as well as consistently looking for new emerging leaders to develop in their nursing career. So the two big take-home things to remember from this whole presentation is just to work together with your manager, with your coworkers, other professional staff. Be kind and supportive to each other. Frequently encourage each other, and that's going to go a long way in retaining those staff members.